Massachusetts is known for many things: our historic past, our sports teams, our colleges and universities, and of course, our healthcare industry. The healthcare sector is still the largest economic engine in the state, employing more people than any other. And not only is Massachusetts home to some of the nation's best hospitals, it's also considered a national leader for expanding health insurance coverage to nearly all of its residents. But Massachusetts has also undergone a significant and rapid demographic shift. According to the 2010 census, Latinos accounted for almost all of Massachusetts' population growth. And 1 out of every 5 Boston residents is Hispanic, and the city itself is now majority minority. One health insurer that has recognized this and has been actively engaging in this growing segment of the population is Tufts Health Plan, headquartered right here in Massachusetts with more than 2,400 employees. To tell us more about its role in the marketplace and its outreach efforts, we've invited the organization's president and CEO, Tom Croswell, and its vice president of Business Diversity, Juan Lopera. Welcome to Urban Update, gentlemen. Thanks for coming in. Tom, I have to say congratulations right off the bat. You were named CEO in January of this year. Tufts Health Plan, congratulations.
Thank you very much.
What would you say are your primary areas of focus now?
Our primary focus is on living our mission. The mission of Tufts Health Plan is to improve the health and wellness of the diverse communities that we serve. And what that means, basically, is to help provide access to high-quality, affordable health care. Now, given the environment that you just referenced, the increasing diversity of the population, a primary focus for us in that regard is tailoring our health care offerings to fit the changing needs of these growing communities.
Okay. Now, Juan, as I mentioned off the top, there's rapidly sweeping demographic changes in Massachusetts have driven to changes in so many industries, but in healthcare, the shift is a critical one to address, is it not?
That's right. Yes, it is. And healthcare, as we all know, is very personal. It is something that impacts all of us, and whether it's seeking care for preventative visits or whether you have more specialty needs for healthcare, it is important to understand those needs. And given the rapid change, as you mentioned, in demographics, we need to understand those differences and know the cultural and linguistic needs of our members and be able to adjust our products and our services to meet those needs.
Mm-hmm. Now, Tom, we hear oftentimes that diversity isn't just the right thing to do, it's also the right business thing to do. Elaborate on that and why it's important. It's an important business imperative for an organization like Tufts Health Plan.
It's particularly important for us because we're the largest health plan in the Commonwealth that provides health coverage to all segments, all individuals in the marketplace, regardless of their age or circumstance. So we need to be able to respond to the needs of individuals, whether they're obtaining health coverage through Medicaid, if they're low-income individuals, through their employer under our commercial plans, or through Medicare for our seniors population. And in serving that broad population, it becomes obvious to us that we have a wide variety of needs that we need to address. I mean, as Juan referenced, there are cultural nuances in healthcare, and we need to be cognizant of that as we design our products and services and respond to our members' needs.
Okay. Now, Juan, talk about some of these specific initiatives that you've implemented to increase Tufts Health Plan's commitment to diversity.
Right. Yeah. So I'll start by saying that the commitment really spans across everything we do as a health plan, from the top to every area of the company, with Tom's commitment to it. But every aspect of what we do, we've asked all of our leaders in every area, whether it's our human resources, whether it's our service, our operations area, our commitment to community, really everything we do looks through the lens of diversity and meeting the needs of our diverse communities. Specifically, one of the areas that we have become very interested in is health equity. We have formed a group internally that looks at health disparities regularly and then adapts our programs to meet those needs. Particularly, one example of that is for the Latino community. We know that diabetes is a very prevalent condition within Latino adults. the prevalence is about twice what you see in the white community, for instance. And Latinos are 40% more likely than others to die from diabetes. So it's a critical issue, one that we've have made a priority from a clinical standpoint. And knowing that we can't do it alone, we partner with providers in the community that know how to do this well. One example of that is the Latino Diabetes Program at Joslin Diabetes. In fact, they're going to be joining forces with us at the upcoming Latino Family Festival, which is very exciting to do screenings on diabetes. So that's one example of the type of activity that we're doing to better serve our community.
Okay, now Tom, Tufts Health Plan has always been very active in the community. Can you sort of talk to us a little bit about some of the specific ways you've engaged people in the community?
You know, we have a very long and proud tradition of serving the community, and as one example of that, back in 2008, we established our charitable foundation. And since 2008, we've granted more than $20 million to dozens of nonprofit organizations in the community that are helping to address needs that exist in the community. Beyond that, we have a very extraordinarily committed employee workforce, people that really want to do the best to serve our members and the broader community. Each year we have a volunteer day, and during that day, hundreds of our employees fan out across the state to support local activities to help communities where they need to help. This most recent one, we had 400 people in 10 locations doing everything from some landscaping at the Dimmick Community Health Center to helping map bus routes for sight-impaired individuals at the Perkins School.
Okay. And Juan, just in remaining seconds here, we have to wrap things up, but I just want to remind everyone about the upcoming Latino Family Festival at Fenway Park. You mentioned that. Briefly, what can people expect on that day?
Well, you can expect a large presence from Tufts Health Plan at the festival. We're going to have our team. We're going to be partnering with Joslin Diabetes, and we're going to be providing health screenings, as I mentioned earlier, and we'll have a photo booth, so we expect everyone to stop by and take their photo. Okay, sounds like a great time. Juan Lopera and Tom Croswell from Tufts Health Plan, thanks for coming in, and good luck with all the great work you're doing. Thanks. Okay, some exciting news for Boston's arts and culture scene. All the details coming right up. Stay with us.